water pills is another terminology is known as diuretics. Diuretics help rid your body of salt and water, especially sodium salt. Most of them help your kidney to release more sodium into urine, okay, and the sodium takes with it water from your blood and decreases the blood volume. So it's very important to understand the basic definition of diuretics as water pills, okay. So this reduces the blood pressure without altering the GFR, glomerular filtration rate, okay. So now let us to understand, before we go for diuretics, we must know the renal tubule physiology, okay, the understanding of renal tubule. Now this is a renal tubule is a part of nephron, okay. Nephron is a structural and functional unit of this is a kidney, okay, a structural and functional unit of kidney. And if you see the glomerulus carrying the blood, okay, here the filtration takes place, filtered blood will come out and filtrate, pass through this loop, this particular renal tubules and get collected as urine, okay. And these are the part: proximal convoluted tubule, distal convoluted tubule, collecting dirt, connective tubule, and very important one, loop of Henle, okay. So now you have the thin descending and ascending loop of Henle. So first important thing is, the most distinctive character of proximal convoluted tubule is luminal brush border. Proximal convoluted tubule contain luminal brush border. Now if you remember, there are some beta-lactam antibiotic which can be metabolized by brush border, okay. That's why we give some combination, okay. If you want to know that what is the combination, you please go through our earlier videos in the YouTube, okay. The most distinctive characteristic of PCT is luminal brush border. PCT regulates pH of the filtrate by exchanging hydrogen and the sodium, okay. Hydrogen in the interstitium for bicarbonate ion in the filtrate, okay. Full stop. Most of the ammonium ion formed in the PCT during conversion of glutamine to alpha ketoglutarate. So during the conversion of glutamine to alpha ketoglutarate, the PCT form maximum amount of ammonium ion. Now the very important enzyme, which is carbonic anhydrase enzyme, what is the role of it? Carbonic anhydrase. Now if you see, the hydrogen is getting exchanged with the sodium is getting reabsorbed, but this hydrogen is coming after the dissociation of very important molecule, that is your carbonic acid, H2CO3. And this carbonic acid dissociation and the combination of water and carbon dioxide both can be regulated by the enzyme carbonic anhydrase. So this is a very vital enzyme to supply this H plus over here. Now if there is a NIPER question, Bohr effect. What is Bohr effect? Bohr effect, it measures the oxygen carrying capacity of hemoglobin, and that greatly depends upon the carbon dioxide concentration of blood. So carbonic anhydrase is actually this activity of carbonic anhydrase can be understood by the Bohr's graph method, where the hemoglobin oxygen carrying capacity increases and decreases depending upon the concentration of carbon dioxide in blood, okay. So carbonic anhydrase inhibitors. Now we have the first diuretics, carbonic anhydrase inhibitors, known as acetazolamide. So what is the use of these diuretics? Now I have also mentioned all the uses of diuretics. The important use, the aspirin poisoning by acetazolamide. Now acetazolamide also makes the urine alkaline, and it makes acidic drug like aspirin to excrete faster from the body. As you know, the renal tubule, the nephron, they have 4 important functions: filtration, then you have reabsorption and secretion, then the concentration of the urine, which is mainly regulated by the loop of Henle, and as well as the formation of the urine output. Okay. Now the carbonic anhydrase inhibitors causes inhibiting the sodium hydrogen exchange, because if it is inhibited, this enzyme, the H plus ion concentration may not be sufficient, and that's why sodium, instead of reabsorption, it get excreted through the renal tubule, and along with water it increases the urine output. Okay. Now it's important to understand the use of carbonic anhydrase inhibitors. It can be diuretics, it can be anti-epileptic, it can be mountain sickness, and also it used to treat the glaucoma, because it reduces the intraocular pressure. How it can reduce intraocular pressure? Very simple. The bicarbonate ion HCO3 minus is the chief constituent of aqueous humor. Aqueous humor, if it is increases in the glaucoma condition, then we give these carbonic anhydrase inhibitors. We have methazolamide, is a long acting one. Then we have dorzolamide, topical use, and benzolamide timolol is very famous combination to treat open angle glaucoma. And acetazolamide, if you want the IUPAC name, N in bracket 5-sulfamyl 1,3,4-thiazole 2-yl acetamide. The side effect pretty simple. HCO3 minus regulate the blood pH. So definitely the metabolic acidosis is one of the the side effect. Then alkaline urine may causes kidney stone to appear, and then after